Hi, I'm Kara Calkins. I'm the Program Director for the Neonatal Perinatal Medicine Fellowship here at UCLA. I work closely with two people, Dr. Josephine Enciso, our Assistant Program Director, or APD, and Reggie Mateo, our Program Coordinator. I hope over the next 30 minutes, I introduce you to the various resources available to our fellows in the Department of Pediatrics at UCLA, and that includes a robust educational and clinical experience, a robust research infrastructure, and various extracurricular activities to help you reach your career goals. This slide here depicts our mission for our fellowship. Our program is committed to training a group of diverse neonatologists, along with physician scientists and academic leaders. To help accomplish this mission, we aim to provide an excellent clinical, educational, and scholarly experience for all of our trainees. We hope that these experiences will build a solid foundation, not only in medical knowledge and technical skills, but also scientific inquiry and global and community advocacy in the field of not only neonatal, but also pediatric medicine. This mission will help ensure that the next generation of neonatologists have the knowledge and skill sets necessary to advance healthcare and science for all babies and their families. Over the next couple of slides, I'm going to introduce you to 14 faculty members who work here within the Division of Neonatology. All of them have diverse clinical expertise and research experience. First off is Dr. Caliper. He's a professor of pediatrics, and he's the division chief of neonatology. He runs an active basic science laboratory that's NIH funded and concentrates on perinatal infections, immunology and lung injury, along with chorioamnitis and how that relates to preterm labor. Dr. Mina Garg is also a professor of pediatrics. She's the medical director of our NICU at Ronald Reagan Hospital, and she also serves as the medical director of our neonatal ECMO program that's been in existence since the early 1980s. Her clinical and research expertise lie in the area of brain injury, ECMO, and neonatal nutrition. Dr. Casavan is an assistant clinical professor. She's the medical director at Santa Monica Hospital, one of our satellite sites that our fellows rotate through. She's also the medical director of our two high-risk infant follow-up clinics that operate at Ronald Reagan and at Santa Monica. Her research and clinical interests focus on the area of cerebral palsy and various neurodevelopmental disorders and early screening for these disorders and diseases. Dr. Uday Devaskar is a professor of pediatrics. He's a medical director at one of our satellite sites, Centinela Hospital, and his interests include human milk and global health. As I mentioned, I'm Kara Calkins. I'm an associate clinical professor. I'm also the program director. I work closely with Allison Shu as the co-director, and we serve as co-directors for the Neonatal Research Council. My research interests include growth and body composition, fatty acids, liver diseases, namely IFOLD and NAFLD, and the gut microbiome and metabolome. I run an active NIH-funded clinical and translational research group. Dr. Chu is an assistant professor in residency. Again, I mentioned she's the co-director of the NRC, or the Neonatal Research Council. She also runs an NIH-funded basic science laboratory that specializes in the area of vascular diseases of the neonate, namely retinopathy of prematurity and placental insufficiency as it relates to fetal growth restriction. Dr. Enciso, as I mentioned, is our APD, but she also oversees all of the fellowship programs within the Department of Pediatrics. She's a longstanding interest and an expertise in the area of medical education, particularly as it relates to pediatric fellows. Margaret Nguyen is an assistant clinical professor. She's also the associate medical director at Centinela Hospital. She's actively developing our POCUS program at Ronald Reagan Hospital and has specific interests in medical education, NRP, and QI. Marlon Tuman is assistant professor, and she runs an NIH-funded basic science laboratory that focuses on the area of pluripotent stem cells and the genomic and transcriptional regulation of heart development. She's also the founder and the director of the Congenital Heart Disease Research Program. Animesh Sabonis is an assistant clinical professor. He's the director of health equity and analytics strategy for the entire health system at UCLA. He's the founder of the Neonatal Anti-Racist Working Group within our division. He's also the founder of our Neonatal QI Collaborative. His specific interests include QI, ethics in neonatology, and diversity, inclusion, and equity. Dr. Ferrardo is an assistant clinical professor. She has a basic science interest in cardiac regeneration, and she has a clinical and translational research interest in perinatal infections and how they alter short and long-term neurodevelopment. Next is Theodore DiBerto. He's a clinical instructor. He runs our newborn nursery, and his clinical interests are ECMO, extreme prematurity, and surgical disorders of the neonate. Our last two faculty members that I'll introduce you to are Ben Makadengde, who's an MD PhD. He's an ex-fellow. He completed the physician scientist training program during his fellowship here at UCLA, and he has a specific basic science interest in the mother-infant microbial handoff. Last is Jane Chung, a clinical instructor. She's now the director of our Neonatal QI Council that was founded by Animesh Sabanis, and she has specific interests in QI and small baby care. So I hope that gives you an idea of the diversity of our faculty within the Division of Neonatology. We have senior faculty, junior faculty, and all of our faculty have very specific clinical and research expertise. This slide here depicts the 9 neonatology fellows. We have 3 spots per year. And again, like our faculty, our fellows come from various areas throughout the entire United States, have specific clinical and research interests, and go into various professions within the field of neonatology. I'm going to introduce you to our 2 training sites that our neonatology fellows rotate through. So we have 2 training sites, Ronald Reagan UCLA Medical Center. Our fellows in their first, second, and third year spend time here. The second site that complements their training is Santa Monica Hospital, and first-year fellows rotate through Santa Monica Hospital. So Ronald Reagan is a level 4 NICU, and while it only has 22 beds, it's generally over capacity, and the pathology is quite diverse along with the acuity. We have an active DR with approximately 2,100 deliveries per year, about 500 admissions to the NICU, and we're a major transport center, not just for Southern California, but for Western United States. We run a robust ECMO program, an active cooling program for HIE. We have a neonatal and pediatric dialysis program, and we have a CT program, and we have a robust surgical program that operates in conjunction with a CT ICU. So over the next couple of slides, I'm going to introduce you to some of our division's specialized expertise. As I mentioned, we're an active ECMO program. We're also an ELSA Center for Excellence, and this has been in existence since the early 1980s. We offer advanced neonatal respiratory care, not only in the form of conventional ventilation and high frequency, but also invasive and non-invasive NAVA and bubble CPAP. We have an active ground and air transport system that transports babies throughout this, not only throughout California, but also the Western United States. To help us accomplish our clinical mission, we work with a lot of subspecialists. Our maternal fetal medicine colleagues are key to our success. As I mentioned, we have an active CT surgery program. Our surgeons perform approximately 350 surgeries per year and about 25 heart transplants. Specific to neonatology that may be of interest to you is our cardiologists run a fetal cardiology program with fetal echoes or a specialized fetal echo program. We also have a PPH program that begins in the neonatal period, extending into early adulthood. To help us diagnose patients with complex disorders, we have access to cardiac CT and advanced MRI. Our surgeons, along with our cardiologists, do hybrid procedures and perform cardiac caths, and we have the ability to do 3D printing to help plan for complex cardiac surgeries. We also have IR expertise in the area of complex lymphatic disorders. This is one of the few centers across the United States that provides treatment for complex lymphatic disorders. We also work with our pediatric surgical colleagues to help perform neonatal surgeries, both here at Ronald Reagan and Santa Monica Hospital. We have an active neonatal neuro ICU where we provide cooling, amplitude AEG, video EEG, 24-hour, that's continuous, and we also have NIRS available. We have expertise in seizures along with brain mapping and epilepsy surgery. We have a TS program or tuberculosis program, and then we work really closely with our neuroradiology colleagues for the intervention of complex AVMs and vein of Gallons, diagnosed prenatally or postnatally. To help us take care of some of these complex patients, we work with our nephrologists, and as a result, we offer dialysis, both peritoneal dialysis, hemodialysis, and continuous renal replacement therapy. We're also a center for rare diseases, and so we offer the whole gamut of genetic testing, from basic chromosome to FISH tests to microarray to whole exome sequencing. In conjunction with our endocrinology colleagues, we have a hyperinsulinemia program. We're one of the few centers in the Western United States that has an FDOPA PET scan for the diagnosis and management of congenital hyperinsulinemia. Our pediatric GI and hepatologists are internationally known for their expertise in intestinal rehabilitation and multivisceral transplants. They also run an outpatient nutritional support center that sees a lot of our infants who are discharged from the NICU who receive alternative feeding methods. As I mentioned, there's 2 sites for our fellows. That includes Ronald Reagan and Santa Monica, but our affiliated sites include Centinela, Los Robles, Allevue, and Miller Children's in Long Beach. So our fellows again rotate at Ronald Reagan and Santa Monica. They're approximately 4 miles apart. In LA traffic, while this should be only 12 minutes, it's probably more akin to 25 minutes. These 2 sites are great complements of each other. As I mentioned, Ronald Reagan is a high acuity unit with a lot of surgical complex disorders and diverse pathology. And Santa Monica is a level 3 unit that mainly cares for extreme premature infants, along with bread and butter neonatology diagnoses. So again, this is level 3. It has 16 beds, about 1,500 deliveries per year, and about 200 admissions to our NICU. We do offer cooling. We do have high frequency and nitric oxide. Our subspecialists rotate at Santa Monica Hospital. So as a result, we are able to perform some surgeries, but extremely sick babies who need high level of care will be transferred to Ronald Reagan Hospital. So here's our schedule for our neonatology fellows. Of course, this is a 3-year program. Our fellows do a total of approximately 52 weeks of clinical service during their 3 years, and a total of approximately 92 weeks of research. What you'll notice here is that the first year is clinically heavy, and in the second and third year, our fellows are afforded 80% research protected time, and that's regardless of extramural or grant funding. So in year 1, our fellows rotate through both Ronald Reagan and Santa Monica Hospital. They spend approximately 18 weeks at Ronald Reagan, 9 as the day fellow, and 9 weeks as the night fellow. So at Ronald Reagan, our day fellow is at the NICU 7 a.m. to 6 p.m. Monday through Friday. We then have a night fellow 6 p.m. to 7 a.m. and that fellow is there Monday through Friday. We think this type of night coverage preserves not only clinical care, but also ensures appropriate education for our pediatric residents who rotate through the Ronald Reagan NICU. 24-hour call is afforded to the Ronald Reagan Hospital on Saturday and Sunday, and that fellow is separate than the day fellow and night fellow. We have a backup fellow system in case of emergencies, illnesses, or unexpected events. You can see in year 2 and year 3, our fellows only rotate through Ronald Reagan Hospital, and they spend approximately 8 weeks there. In their first year, our fellows spend 16 weeks or 4 months at Santa Monica Hospital. And again, this is a bread and butter NICU that introduces you to common disorders of premature infants. In the first year, our fellows have 14 weeks of research service. And during this time, we expect them to identify a research mentor and develop a research project so that they can hit the ground running during their second and third year, so that they will be able to produce a scholarly work product to submit to the American Academy, to the ABP, the American Board of Pediatrics, in order to graduate. Each year, our fellows are given 4 weeks of vacation, which is standard. So as I mentioned, we have two high-risk infant follow-up clinics. They're run by Dr. Kosovan, one at Ronald Reagan and one at Santa Monica. Our fellows rotate through these clinics. They're multidisciplinary clinics. They're overseen by a neonatologist, a developmental pediatrician, Dr. Iyer. At those clinics, we have a dietitian, OT/PT, and a social worker. At Ronald Reagan, the clinic operates on Tuesday from 1 to 5, and at Santa Monica, it operates on Thursday, 1 to 5. So as I mentioned, the two clinics at Ronald Reagan, the fellow who rotates through the Ronald Reagan Clinic is not on service because our fellows at Ronald Reagan are quite busy. So our first years have 3 clinics at Ronald Reagan, and in their second and third year, they have 6 clinics per year. At Santa Monica, because it's a level 3, the fellow on service, which would be a first year, rotates through that clinic on Thursday afternoons, which is from approximately 1 to 5. So these clinics give our fellows a good introduction to the Bailey 4 and other screening methodologies to help diagnose various neurodevelopmental disorders, including cerebral palsy. So that gives you an idea of our educational or clinical experience that's provided to our fellows. So now I want to switch gears and talk a little bit about research, which is a big component of fellowship. So in order to graduate, all pediatric subspecialists are expected to engage in scholarly activity and research, and they have to produce a scholarly work product, usually in the form of a peer-reviewed manuscript to the American Board of Pediatrics in order to graduate. So we realize fellows come with various backgrounds in research. Some fellows have no background and others have extensive backgrounds in the form of PhD. But regardless of your experience, we believe that our division and our department and the campus of UCLA offer a tremendous amount of resources to ensure that you can be successful in your research endeavors during your fellowship. Our fellows develop an individualized development plan. They work with their research mentor to develop a scholarly oversight committee. Many of our fellows work with members within the division, but we encourage them to consider mentors in the Department of Pediatrics and beyond. We're fortunate within the Division of Neonatology, we have 4 R01 faculty members who not only receive support from the NIH, but also industry and various foundational support and are part of various collaborative research networks. Our fellows are encouraged to attend scientific conferences such as WSPR, the Western Society of Pediatric Research, and Pediatric Academic Society. So to help our fellows succeed in research, we have developed, like I mentioned, a robust infrastructure within the division that's supported by the department and institution. So we're fortunate to have the CDI in the Department of Pediatrics, and the CDI stands for the Children's Discovery and Innovation Institute. This provides a range of support, mainly in the form of grants for our fellows, but also educational lectures. The department recognizes that many fellows or trainees have a lot of debt that can impact their career choices. So we're fortunate to have a fellowship loan repayment program, and that's a nice complement to the NIH LRP. We have a lot of internal grants available to our fellows, and those are in the form of T32s, and a T stands for training grants, and those are sponsored by the NIH. Many of our fellows receive training grants through various divisions and departments. It's not required that our fellows receive grant support, but any fellow who's interested in intramural or extramural funding will help them with their grant applications. And as I mentioned, we've had a fellow complete the physician scientist development program, and that was Dr. Ben Makadangdang. So here's just a glimpse of what our fellows have done in the past 10 years or so. Our fellows work with a diverse group of research mentors, not just in the division, but beyond the Department of Pediatrics. Many of them have successfully obtained grant funding here at UCLA. You can see the area of research. It extends from GI to pulmonary to macrophage function to cardiology to neuro, et cetera. So again, we're really fortunate to be a part of a larger campus at UCLA that offers a lot of resources. So here are some of the resources available to all trainees. There's search engines to help you find a mentor, but of course, myself and others provide individualized counseling to help you find the right fit. There's lots of funding opportunities. But for fellows who are interested in pursuing advanced education, we've got a lot of programs that meet your needs. So for example, we have a medical education certificate program. We have within the department a pediatric QI training program. We've had fellows participate in the STAR program, which stands for Specialized Training in Advanced Research. And the STAR program offers a PhD or a master's in clinical research. And we also have a health resident informatics program that our fellows have participated in the past. So any type of advanced training program, I think, is available here at UCLA. And as I mentioned, our campus has a lot of depth. We have a CTSI, a Clinical Translational Science Institute, lots of support here for anyone within the department, whether it's needing help writing an IRB or a grant, et cetera. It's a great resource for not just trainees, but for faculty members. So beyond the Department of Peds, UCLA has pretty much everything. The only thing we don't have is a school of pharmacy. Of particular interest is our Stem Cell Research Center. We have a Nanosystems Institute. We have a bioengineering department, an active neuroscience department, and a school of public health. So that's the research opportunities we offer here at UCLA. I'm going to talk a little bit about the educational opportunities. So we run an NRP boot camp that's run by Dr. Enciso and Dr. Nguyen. It's over 2 days, and this is just a glimpse of the schedule. We also offer a 2-day ECMO course for all of our fellows and faculty members. We have an active simulation center here on campus, which is a great venue for our fellows to participate or to practice in mock codes and various procedures, whether it's intubating, chest tubes, umbilical lines, tapping the heart, et cetera. Lots of conferences to support your education. It's hard to go through all of them. Of particular interest, every week we have chief rounds, and that's led by Dr. Caliper, our chief, along with Nina Garg, who's the director of the Ronald Reagan NICU. And this is an interactive, off-the-cuff educational conference where we talk about complex cases in our NICUs and solicit feedback from all members of the community. Our monthly conferences include M&M. We also have a perinatal conference that's bi-monthly. The first conference focuses on antenatal cases that we can work with our subspecialists to plan for those deliveries. And at that conference includes not only MFM, but also cardiology, pediatric surgery, radiology, and genetics. That's complemented by a conference 2 weeks later where we talk about the postnatal cases or the babies who've been born, and we give updates to our colleagues about the delivery and how those babies are doing in the NICU. Each month we meet with our pediatric surgical colleagues to discuss active cases and give updates on patients who've had recent operations. We also have a board review course that provides lectures on the respiratory and cardiovascular system. We have journal clubs and case conferences. And again, these 2 conferences are led by our fellows. And that's complemented with a pathology conference. About 8 times per year, the NRC, or the Neonatal Research Council, meets. And then lastly, we have the Neonatal QI Improvement Council and the Perinatal EDI Coalition, which was originally the Anti-Racist Neonatology Working Group. So again, lots of conferences to support various opportunities, and then also to ensure that all of our fellows get equal access to basic neonatal physiology and common diagnoses within our field. So I mentioned our QI Council, which I think is a really important aspect of our division and fellowship training. All of our fellows participate in some QI. You can see our mission statement is listed here, but the whole goal is to tackle active problems by bringing people together to come up with evidence-based solutions and to actively use data, particularly data generated from the EMR. So here's an example of some of the work our QI Council has done. We believe in using real-time data. So we have a real-time visualization of key performances. Our metrics are provided by CPQCC and Vaughan. You can see some of our current projects, past projects, and future projects. So one of our original projects from the QI Council was looking at growth in very low birth weight infants. And you can see here, we have a color-coded system to tell our clinicians at the bedside in real time if your baby's growing great, which is green, not growing okay, which is yellow, and not so good, which is red. Currently, we have, in addition to a growth metric board, we have real-time visualization of patient volume, iatrogenic infections, mortality, and patient satisfaction. We're currently working on maintaining normothermia, and one of the next big QI projects is to support breastfeeding and to improve breastfeeding rates in our NICU and the early detection of sepsis. So here again are examples of our real-time dashboards. Again, this is available to all of our clinicians, faculty and fellows, residents, and other trainees at the bedside. And our goal is to make these metrics easy to use so that you can individualize your care to your patients. As I mentioned, a handful of years ago, Dr. Sabonis founded the Neonatal Anti-Racist Working Group that merged, or that council merged with our MFM and OBGYN colleagues, and now is called the Perinatal EDI Coalition. We're now part of the 2022 Cherish Future Collaborative for Black Mothers and Babies. As UCLA, along with the department and division, is committed to an anti-racist environment and has a zero tolerance to mistreatment. So where do our graduates go? They go all over. Some of our graduates go into clinical care, and other graduates go into academic neonatology. Some pursue a career as an independent physician scientist. Regardless of your career aspirations, this program can fit your needs, and I feel very, very strongly about that. Here are some of the programs our fellows have gone to. That includes not only here at UCLA, I was a fellow here some time ago, but also Children's Hospital Los Angeles, Millard Children's, Children's Hospital of Orange County. Our fellows have gone beyond California to Dallas, to Vanderbilt, CHOP, Washington, and to Utah. And like I mentioned, their careers are quite diverse. Here's our compensation, which is standard for PGY 4, 5, and 6. Here's our benefits, standard benefits, which include vision and dental, disability, life, and accident insurance. We have access to childcare resources, and there's an FSA. There's a housing stipend, and this should be discussed further details with HR. Our fellows and trainees are provided with a stipend for meals. They get reimbursement for their license, and they get standard leaves. That includes 4 weeks of vacation, 4 weeks paid parental leave over the course of 12 months, 12 sick days, and 3 holidays. We also have an educational fund, approximately $1,000 per year, where fellows can use this to buy books, attend specific conferences that they're not presenting at. To help mitigate fatigue, we provide Uber to and fro work, particularly when our fellows or trainees are post-call. And there's a relocation reimbursement. Again, these details should always be discussed with HR. We recognize that all physicians have a need for wellness support, and particularly for trainees in the ICU, we recognize burnout is a real phenomenon. And so we strive to provide an environment that's supportive to all fellows. We do have a wellness center that's available to all trainees, and it's covered by medical insurance. And the campus does have an active wellness program. And within our department, we also have a wellness program for our pediatric faculty. So lastly, I'll end with our values that are dictated by the cultural North Star. They're very simple, but I think it's important to review these. We aim as faculty members and as trainees and other healthcare professionals to do what's right, to make things better, and to always be kind. And we hope that is part of our day-to-day activities at UCLA. So with that, I'm going to end. Thank you for your attention. Hopefully you learned a little bit about our fellowship program. We look forward to seeing you on your interview day. On your interview day, we'll start off with a Q&A. So if you have specific questions about our program that weren't covered here, if you need further clarification, I'm happy to take those questions. And again, thank you for your interest in UCLA, and best of luck to you in your fellowship endeavors.